Hello everyone, I am Dr. Ancil George Thomas, working as consultant neurologist in Muthoot Hospital, Korancheri, Kerala. Today I would be talking to you on epilepsy and associated learning disabilities. Epilepsy is a disorder that involves a constellation of symptoms that vary in frequency and intensity from child to child. In general, difficulties with attention, executive functioning, and memory are commonly reported by patients with epilepsy. It is found in up to 70% of untreated patients. These findings point to shared mechanisms that may underlie the cognitive and behavioral impairment, as well as the seizures. So these are referred to as essential comorbidities. This is further reflected in the current understanding of epilepsy as a network disease. It means involving changes in underlying brain networks beyond a specific identifiable lesion. The primary function of these networks is to support specific cognitive processes and behavior. This suggests that epilepsy is as much a disorder of cognition and behavior as it is of seizures. Approximately 25% of children with epilepsy continue to experience poor seizure control even with anti-epileptic drug therapy. In addition, epilepsy in children is associated with problems in multiple areas. These areas include academic achievement, the behavioral and emotional adjustment, and social competence. Even when seizures are well controlled with anti-epileptic medications, these problems may persist. This is because of abnormal brain formation or its function, continuing epileptic activity in the brain even without symptoms, or side effects from anti-epileptic medications. The overall intellectual ability in children with epilepsy is compared to the normal childhood population, but they are at greater risk for learning problems and academic underachievement. Even in those children with normal intelligence, reports of deficits in specific areas related to thinking and learning abilities are very common. These include areas of attention and concentration, memory, the organizational skill, and academic achievement. Many children do not fit the typical school definition of learning disability, as their reading, spelling, and math skills may be appropriately developed. Common learning challenges for children with epilepsy are the paying attention and concentrating, understanding instruction, using information, describing things to other people, remembering things, working out how to do something new, organizing thoughts or tasks, feeling you have no energy to do things, appearing muddled or confused, sad or tearful, short-tempered or grumpy, difficulty working out sums, writing or copying figures, etc. Learning is important for people of all ages, not just children. Likewise, the impact of epilepsy on children can be experienced at any age. The extent of impact is very individual. Some learners are greatly affected, while others may not be. So the impact of epilepsy is related to the type of epilepsy, its cause, the brain region it affects, as well as the treatment one chooses. Being absent from school or training due to seizures may also affect child's learning. The ability to make sense of new information is crucial to successful learning. So the cognitive issues may impact negatively on the academic outcomes and behavior of children with epilepsy. Memory, as you all know, is a complex process that occurs within the brain. It allows you to store, retain, and recall information and experiences. Although not all people living with epilepsy experience memory difficulties, it is one of the most common challenges reported by people living with epilepsy. The types of memory difficulties that a person has again depend on the type of epilepsy and the underlying causes. Various support services are now available that can help the patient plan and navigate the learning journey. These can be customized further to suit the unique situation and needs of each epilepsy patient. Thank you.